Okay, hello everyone to this webinar today. I am very happy for being here today with you, and thank you for joining us. Today we have a very interesting webinar about the fund request process for the 2020-2022 allocation period of the Global Fund. But first, I want to introduce to you one thing about the Global Fund and the process. The allocation-based financing model for the 2010-2022 financial cycle has hardly changed. In December, the amount allocated to eligible countries was communicated, which will be able to access the new financing during the 2020-2022 period. However, some elements of the model have been updated based on the lessons learned during the 2017-2019 cycle. These adjustments have been designed to improve the impact of Global Fund resources and include updates to eligibility criteria, allocation methodology, application approaches, information that should be included in the funding request, and priority areas for the catalytic investments. To learn more about this, we have a great guest today, and I will introduce to you. Gosia Matyset has been working at the Global Fund for over 7 years, progressing from the support of the high-impact country portfolio in Grant Management Division to the access to funding and society specialist. Within her current role, Gosia is responsible for providing support to the applicants for the Global Fund financing in the funding request development process and grant-making preparations. Before joining the Global Fund, Gosia was managing development projects in Chile, Cameroon, and Spain. Originally from Poland, she has a master's degree in political science. Gosia, it's a pleasure to you have today with us, and thank you for joining us.
Hi, thank you, Diego, and thank you for the invitation.
I apologize for my English, but I'm very happy because you are the expert of the financial cycle in the Global Fund, and we have the opportunity for learn more about that.
Excellent. Thank you. Thank you so much for this very nice introduction. I will now try to project my screen with the presentation. So I click share. That.
Yes.
And 1 second. I hope now you can see clearly. Yes, thank you. Thank you. Good afternoon here from Geneva in this very rainy afternoon we have here. And once again, thank you for this opportunity to present a little bit more details about the application process for the ongoing cycle 2020-2022, as you just mentioned. So I would try to close my presentation within the next 35 minutes. In case there are any other questions afterwards, we will have time to discuss. I will start with giving you some background information and introduction to the next funding cycle. Then I will discuss the funding request and also the required documents. I will talk a little bit more about the lessons learned from the past cycles, and also where you can find additional training and resources, as obviously within the 35 minutes is really difficult to put everything that we have, and also I don't think it's necessary. It's rather an introduction to the process. Let me just start by saying that in October, the Global Fund, we had a replenishment conference that was the most successful in the history. We managed to gather $40 billion with the great championship of the French President Emmanuel Macron and many other leaders from all around the world. This is a very crucial moment for the Global Fund because, as I mentioned, this is the biggest we could ever hope and we ever got. But it also means it puts the responsibility of on the Global Fund, because it means that this is a chance that we cannot miss to use this money effectively. And we hope that through making the application process easier for the applicant, we will be able to use this money more effectively and smoother. So with this 41, we had the money, the 40 billion. We divided across all the portfolio that the Global Fund works with. dividing in with the help of the allocation formula and using approved technical parameters, and then adding to it also qualitative adjustment. Based on that, each of the countries received the Global Fund allocation that was communicated through the allocation letter in December. So what happens next? So once the applicants got the allocation letter, they have to actually start planning on when to come to the technical review panel windows. Some of you may need to do it quite fast, depending on when the grant ends. And the window 1 is already the submission date on the 23rd of March, and that means it's in the 2 months' time. And the window 2 this year will happen on the 25th of May, so in 5 months. That really gives not much margin actually for the country dialogue to help and to have a time to develop a robust funding proposal. So how does it work? But before I go to how does it work, I would also like to mention that what we are talking now here and about the application process and on the development of writing the proposal, it shouldn't take our focus what is really important for the Global Fund. And this is the other part of the cycle, the circle that you can see on the slide, that is the grant implementation. We really hope that the country dialogue and all the work that you have to put in developing the documents, in writing the budget, the performance framework, it will not take too much of your time, and the grants that are already ongoing can be implemented successfully. For the context of the Latin America and the Caribbean, the application approach that we are interested in is the full review, tailored for focus portfolios and tailored for transitions. The other ones are rather for high impact countries for other regions. So I will just today focus on these 3 of the application approaches that we now have at the Global Fund. So once the country receives the allocation letter, we really hope that the country dialogue starts. At the moment of receiving any funding submission from the applicant, the first thing that we actually look at, it's not reading the funding proposal, but actually looking at the complicity with the CCM eligibility requirements. And this is about the transparent and inclusive process of actually developing the funding request, and transparent and documented process of selection of the principal recipient. And what do we mean by that? The transparent and inclusive process, it should be a process that all the parties that actually play a role when fighting the disease at the country level are involved in the discussion. So we mean here, of course, the government, of course, the other donors, but most importantly, the civil society, the key populations, people living with the disease, but also private sector. The funding request, it should only be looked at as a complementary to the documents that already exist at the country level, and it cannot be looked as a document that lives in the silo. The basic document that the funding proposal should be based on is the national strategic plan. So before even going to developing the funding proposal, the country should really focus on preparing an updated, robust and costed national strategic plan. This is really always the first question that the TRP will ask. But where is your NSP? Is it developed? Was it revised? Is it updated? Within the one of the parts of the allocation letters that was sent to the countries was what we call the program split. This is what is the indicative division of the full country allocation between the different disease components. So what happens now that the country, the CCM, can look at the proposed indicative division in the allocation letter and can say, yes, it makes sense, or no, it rather not make sense. In the latter part, we request the CCM then to send this information to the Global Fund with the rationale on why and how this program split should be changed. That will be then evaluated by the Global Fund, and if the rationale is sufficient, then it will be approved. And this will create the funding envelope of which each of the disease components that the funding request will fit into. So today I will focus on the going in depth of the thematic section of each of the funding requests, and it's divided into 4 major parts. So the first one is the context, the country, and especially the epidemiological context. Then is the request itself, and especially the prioritization, opportunities for integration, and what do we call value for money. There is another part that refers to the implementation arrangements and the risks and the mitigation measures, and sustainability section. Also, I will talk a little bit more about the key annexes that are very important part of the submission. I know it's a lot, because for now what we require is actually 11 annexes, and then there's a 12 that is optional, that is only for the countries in transition. However, please also think about it that all the submission, I mean the funding request, and together with the annexes, it should be one. So there is no need of repeating information that is mentioned already somewhere else, and also all these documents should be complementary to itself. So how to write a funding request? So to write the funding request, actually you need a template. And we hope that each of the country teams, the secretariat, together with the funding, with the allocation letter, it's sent. Normally we send the funding request applications and all the templates necessary. But in case it was not done, or maybe you missed some of the documents, at the Global Fund website, in the link that you can see here in the slide, you can find all the information and all the documents. And now I will be presenting 13 steps of how to develop a funding proposal. So the first section is context, when we actually ask the CCM to present what is the country context that inform the development of the funding request. So please use it as in order to set the scene, to describe the country context using the available data from national and international documents. And as I already said, please do not repeat what is written everywhere, somewhere else. For example, do not repeat parts of the national strategic plans or any other relevant document. It should rather serve to provide an analytical part into it. Also important thing in this part, please kindly include how the TRP issues and recommendation from the previous review were addressed, and then what are the lessons learned. The next part is where we ask the applicants to summarize the approach, use the prioritization of module and intervention, and how this decision were made, and based on what circumstances. What we have added in this funding cycle is actually a table that should be filled in for each of the the components to describe these priorities that the CCM asks to be funded by the country team. So all responses in these fields should be briefed and should really get into the point. We put this table form actually to make it more streamlined. It happened that many times we were getting pages of information that were not really adding much value, and it's a lot of work for the applicant, but it's also a lot of work to TRP. So please kindly be as streamlined as possible and up to the point. So for example, when we talk expected outcomes, you can even use a numeric outcomes, bullet points, whatever it easiest for you. The step 3 is the payment for results. So this part is optional, and it should be only used for the countries that actually are using the modality payment for results. Please do remember that the payment for result is the modality that can be used for entire program, for entire component, but it can also be used for for modules. So, for example, if you think that your program of working with the community health workers will be better, the impact will be better achieved through this modality, you can always discuss it with the country team as how to best apply it and how to actually approach this issue in this more innovative approach. Opportunities for integration. It is also a new question, and this comes from the board TRP recommendation for the Global Fund programs to be more cross-cutting. And as you know, and for youth who work for years with the Global Fund programs, we rather tend to be a little bit too vertical. So it happens sometimes that the three programs have each of the programs have its own community workers, and each of the programs have its own transportation system. And there is in the world of restricted resources, we also think that the integration is also opportunity to create efficiencies and maybe use this money to be invested better in other areas. Important thing that when we talk about the integration, it's not for the totality of the programs. We are very much aware that there are parts of each of the disease components that integration is not possible. Let's take service delivery. So we ask to focus on what we call the RSSH building blocks that are health management system, that is the HMIS and monitoring and evaluation, human resources for health, integrated service delivery and quality improvement, financial management system, health sector governance, community system strengthening, and laboratory system. So the integration proposal may, but not have to be limited to these 8 RSSH building blocks. The step 5 is the compliance with application focus requirements. Those requirements are actually very much specified in the allocation letter. In the context of Caribbean or Latin America, most of the country will have indeed the application focus, 50 or 100% of its intervention that needs to be focused on key populations. The next section is value for money. And in this part, we ask the applicant to focus on 3 areas, that is economy, efficiency, and equity. I would have, it is already last cycle that we work with the value for money, and there is this question in the funding proposal. However, we do see that the applicants struggle with how to answer this question. And I think I kind of relate to that because it's a very conceptual approach, and probably each of the donors has its own definition of it. That's why I really strongly recommend that before going to fill in this section, that you actually read what is the value for money information note. It is available on the Global Fund website. It is not too long and too complicated this time. We did change it as compared to the last cycle, and we do put it some practical example for you to help you to better understand what we actually mean by value for money. The section on matching funds is also optional. It's only for the countries that in the allocation letter they were notified that they did receive the matching funds. In the past cycle, you were able to submit the matching fund request separately from the funding request. It could have happened later, but it has changed. Now the matching fund has to be incorporated in the same funding request. So please do not forget that if in case you are a recipient of the matching fund, you have to when you're developing the funding proposal, the allocation envelope has to be matched with the matching funds, and the entire proposal has to be presented together. And then we go to the next part of the funding proposal, that is the implementation arrangement, and when the applicant has the opportunity to also describe the role of subrecipient, but most importantly to also mention the role of the organization that are crucial to achieve the impact and achieve the targets of the program, even though they don't receive direct money allocations. It is very important for us, and especially for the TRP, to understand how the program fits in the whole structure of the national health system. And the second important part is also to mention the role of the community-based organization. What's their role and what's their participation of the program? There is one question, very specific, and some may ask why actually you are asking that. And it's the question if for the countries where the principal recipient is an international institution. So you have to, in the case this is the issue in the country, you just have to tick yes or no. But the most important that you have to actually explain how in the nearest or furthest future you will transfer these responsibilities to the national entities. As you know, one of the premises of the Global Fund is the national ownership, and we always go with the organization that preferably are the local entities. So if your country is in the situation when there is no local entity that can take the PR-ship, we ask the CCM to actually ask the question, okay, so this is the reality, we are in crisis, we are facing big challenges, but what actually we are going to do in the next 6 years to be able to go to transfer from this international institution to the local entity. And it can be either a government or public entity, or also a civil organization. When it comes to the implementation risks, we strongly encourage to actually focus on the 3 main anticipated implementation risks. We know that the programs and the Global Fund programs are a complex animal, so probably we can have a list of the risks, but it's not the point. It's actually try to find the areas when we can move the needle, when actually finding the mitigation measures and implementing them in the effective way can make a change. So instead of putting lots of effort in many small activities, we would rather recommend to focus on the 3 main areas and try to deliver upon them. The next part is also an optional question. It's about joint investment platforms, and in some countries, the CCMs are working together with the financial institution, like for example Inter-American Development Bank, to develop a program together. So in these cases, please kindly explain how the organization of it will happen, and what will be the Global Fund role played into it. In case it do not happen, please leave it blank. And the next part, and it's the last part of the funding proposal, is what we call the sustainability, transition, and co-financing policy at the Global Fund. And first of the questions refer to the co-financing requirements. So it has 3 parts, and the first part look back at the current commitments and how they were realized. The second looks forward, so the new commitments for the new period, what will they be? And the third part, it is about the co-financing incentives. And please also remember that this part, and especially the co-financing requirements part, should be aligned and should match with the information that is given in the funding landscape table. Then there is a part of the sustainability in transition. So the countries that are not transitioning, please focus on the sustainability part. So please clearly refer to all the national documents that include financial commitments. Also, what is very important is to highlight challenges that relates to the sustainability. In many of the countries in the LAC region, there is already sustainability strategies that were developed. Please kindly refer to them. Please kindly say what has happened since the development of the strategy, what changes have been made, what activities were being implemented, what is the impact, and what are the challenges. And then the last part is only for the countries that are transitioning out of the Global Fund financing. So, as I mentioned, the funding request is only one part of what is the submission to the Global Fund. Then we have the funding request annexes, and now I will talk about a bit more about it. And I will finish, I will start with one that is actually a new annex that I'm sure you haven't seen yet. It is essential data table. So actually with this premise of increase the integration within the programs, we have created an Excel table where we gather all the indicators for the three components, for HIV, tuberculosis, and malaria, but also for the RSSH for each of the countries. These indicators, they come from the international publicly available domains, especially from our technical partners like UNAIDS, Rollback Malaria, WHO. And the idea is that the country, the CCM, is provided with the broad overview of the disease situation in the country, and that with this it will help them to have a broader and complete view of how to best prioritize the funding request. Of course, it happens often that actually the data that is reported by the international agencies not always matches what the program uses. In this case, in this Excel sheet that was provided or will be provided to you, you have the last column that is called remarks, when you can actually put the comments if the data doesn't match what is used by the program. It is the document. It's very important, and actually we created it on the special request by the TRP, because it also helps for the TRP then to review when they review to see exact data on which the funding proposal was developed. The next important part and the important change is about the part, so what we call the prioritize above allocation request. So the same what happened with the matching funds. In the last cycle, you were able to submit a standalone PAR application. This has changed. You are obliged actually to submit the PAR application with the funding request. And we also request that the PAR should be at least 30% of the allocation amount. Of course, the PAR is because PAR is actually requests for money that are not there yet, and it's a very dynamic document. It can be updated afterwards during the allocation cycle, even after the submission of the funding request. Nevertheless, it has to be submitted, the first version, together with the funding request. What is the funding landscape table? What is the programmatic gap table? There is no much that has changed. So I don't think I would dedicate too much time. Just please remember that there are crucial documents for us. And even though people maybe sometimes consider, oh, you know, this, nobody reads it. Yes, the TRP has its dedicated time, and each of the TRP members, they will open all of this document and they will look all of this data, and they will, and even more, they will analyze all of this data, and they will see if there is the coherence between the programmatic gap table, the funding landscape table, between the programmatic framework. And it's only because it's only when it's all of them, they tell a story, the TRP can be sure that there is a clear vision of what we actually try to do in the country and how we plan to reach the impact. For the program performance framework, I will stop here because in this cycle, there was actually significant updates that were made to the Modular Framework Handbook. The Modular Framework Handbook is the document that stands behind what is the Performance Framework Excel document, which is where we explain all the indicators, the modules, the interventions. So once again, a big request from my side, please kindly refer to it and familiarize yourself with it before starting to fill it in. So maybe I will now go to some of my the Secretariat's recommendation for development on funding proposals. So as I mentioned, and I will be boring a little bit with that, but let me repeat once again, please treat the whole application as one, the funding request together with all annexes. And sometimes it's even better to complete certain annexes even before you go to the funding request. Funding landscape table, programmatic gap tables, all the places when actually you see what is going on, you see where is the incidence, you see where are the geographic areas that we need to focus. Please try to analyze it before you start writing the story. As I also mentioned, the data should be consistent across the funding request narratives and attachments. And also, from my personal experience, if the data and information is complete and consistent at the stage of the funding request, it will help you to actually suffer less during the grant making process. So here I just providing the dates for the 4 next windows of the TRP review. So we have 3 planned for 2020, and for now it's only 1 for 2021. There will be more, but this is as much as we have planned for now. And here also we have, in this cycle, we have developed a very broad library of documents that can help you to develop the funding request. I know it is a lot, and I know that even looking at the amount of the information to read and to digest, it gives a headache. So to help you with that, we also prepared some of the e-learning courses, and I promise we have improved significantly as compared to the last period. They are more interactive, they are shorter, they are easier to understand. So I think anyone who has some spare time, I strongly recommend to have a look at it, and especially if you have any question. And if after reading all this, you still have a question, or you just want to say hello, I'm leaving here the access to funding email address, but also my personal email. So in case there's any other question, I will be happy to help. Back to you, Diego.
Thank you, Gosia, for the clear presentation. We have some questions. The first, can proposals be submitted without the support of the Ministry of Health of the country?
Sorry, I'm trying to open the Zoom, but I cannot, so I would just leave it like that. The proposals for the country, when there is a CCM, country coordinating mechanism, has to be presented by the CCM. What is the composition of the CCM? It is decided at the country level. It really depends on the context. So in some countries, the government plays a crucial role. In some countries, maybe they are less active, really depends. But nevertheless, it has to be endorsed and developed with the lead of the country coordinating mechanism.
Okay. Another is, can support guidance be requested from the Global Fund to complete the proposal? And if it's possible, what area?
Excuse me, can you repeat the beginning?
Yes. Can support and guide be requested from the Global Fund to complete the proposal? And if it's possible, what area?
So yes, there is a technical assistant. So there is a very small part of the technical assistant that is provided by the Global Fund, and this is because there exists a conflict of interest. So it will be a little bit weird that the Global Fund funds finance the development of the Global Fund grants. So it's rather that for this, the technical partners, they have a lot of resources available and technical assistance for the development of the funding request. So once again, I would suggest to engage with the technical partners that are present in your country, and to see what are the opportunities for support.
Perfect. Another. At what point in the process can communities participate and how?
Mm-hmm. The communities, the people affected by the disease, should participate in the process from the moment zero. So they should, because they are the crucial part of the country dialogue. And the country dialogue, should not only happen when we are developing the funding request. We actually hope that the country dialogue is the constant process that happens at the country level also during the implementation of the grants. For each of the CCMs, they have to have representatives of the communities, and if not, they do not comply with our requirements. So we do hope that it happens. And if not, if somebody who listens to me now, feels that it's not represented in the CCM, I strongly suggest to go back and to actually request the opportunities to participate.
Perfect, thank you. And the last one, you have already given us several tips on how to complete the financing process, but what are those tips that should be taken into account when completing the form? For example, I said you the last webinar, if the numbers of characters influence the response or not.
I think that there are several things that I have mentioned, but maybe the important thing is to have, let's say, the thinking process before sitting to write the funding proposal. And the thinking process is to have to be clear of what actually we want to do with the money that is available from the Global Fund, and how best to reach this impact in the efficient way. And only putting and answering these questions at the CCM level and seeing some of the priorities, only then start to write the proposal. When it comes to the word limitation, you will see that in the instructions to the funding request, we're giving some indications. However, we are not very strict on that. It's always better to be more consistent, to just try to present to argue for your case in more efficient and more in a shorter way, and then complement it with other documents. It's really no point of writing the story or copy pasting information from other resources. As I mentioned, the TRP, the Global Fund here at the Secretariat, the country teams, we do read the documents. This is our job. There's no need to repeat the information.
Okay. Do you want to add something else, Gosia? We don't have more questions now, but
I think that what I wanted actually to add was already the questions were really up to the point. So no, just from my side, I think especially for the countries that are coming for window 1, I'm sure that they're already stressed. But even the one that are coming for window 2, 5 months is really nothing. I truly recommend that you start thinking about it, that you start the dialogue, because the more reflection upon it, the better the proposal is at the end.
Perfect. Again, thank you very much, Gosia, for the presentation. We
Thank
hope
you so
can
much.
be with us another time.
Thank you so much. Thank you, and have a good weekend.
Thank you, Gosia. And you remember that you can follow us on social media, such as Plataforma LAC. It's in Spanish, but you can find information in English too. And visit us on our website, plataformalac.org, and comunidad.plataformalac.org. And see you at the next webinar. Please connect with us in social media and our web. Thank you, Gosia.
Thank you. Bye-bye.
Bye-bye.